The last years have seen dreadful numbers in Yemen regarding food insecurity. These numbers haven't been possible except with Houthi looting of humanitarian aids that comes to the country. More details are in the following report.
5 Yemeni districts held by the Iran-backed Houthi militia might face starvation, according to an international agency specializing in food security assessments. The organization cautioned that the conflict in Ukraine, which supplies Yemen with around 30% of its annual wheat needs, threatens to worsen the situation in Yemen. A request was made to the Famine Review Committee, FRC, to assess the plausibility of the Integrated Food Security Phase Classification, IPC. Yemen Technical Working Group, TWG, Acute Food Insecurity, AFI, and Acute Malnutrition, AMN, classifications in 5 Houthi-controlled districts in western Yemen, namely Abs, Harad, and Midi in Hajjah, and Al-Hali and Al-Hawak in Hodeidah. The FRC discovered that the categories and population projections based on the evidence available at the time of the analysis are widely credible for the existing and anticipated classifications in Abs, Al-Hali, and Al-Hawak. It did, however, decide that there is insufficient evidence to justify a famine classification for Midi and Harad. The committee determined that the extrapolation from Abs data for both acute food insecurity and acute malnutrition analyses were implausible. It proposed that the Yemen Technical Working Group review the presence of the inhabitants residing in these areas, as well as their circumstances, rather than classifying them. It was noted that the Ukraine crisis transpired in the immediate following of the Famine Review Committee activation, necessitating a revision of the scenario definition for the projected period. The FRC emphasized that the risks associated with the Ukraine crisis require a re-evaluation of the assumptions developed by the Integrated Food Security Phase Classification Analysis System, particularly the prices and supply of wheat and fuel, as well as a change in the geopolitics surrounding the Yemen conflict and possible shifts in humanitarian programming in the coming months. It identified a number of risk variables that might change rapidly during 2022. These factors and/or the possible degree of change are a result of recent events that could not have been predicted at the time of the Yemen IPC studies. Nonetheless, the FRC said that these variables may have an impact on TWG classifications across the time spans they cover. Without close monitoring and prompt reaction to any changes, the committee expressed concern that the severity of Yemen's food security, nutrition, and health situation might surpass the thresholds already stated in the current and projected time periods.